Greetings of the day. Today we will discuss the thing about summer care. Now summer is coming. We must know how to care ourselves, how to be protected from this summer. What happens in summer? There is a heat, dust that all affect our health. You might be knowing heat stroke. Heat stroke happens when body's core temperature increases more than 103 degree Fahrenheit and person is working in the hot, humid environment. That is happening in the April, May in our city, Hyderabad. It is very common in these 2 months. Now, what is the heat stroke? What is the heat exhaustion? These two are the different things. If you take a scale, heat exhaustion first comes and then comes heat stroke. Now, first we must understand what is heat stroke. Heat stroke is disease, body's pathophysiological condition in which our body's core temperature goes up to 106 degree Fahrenheit, even more than that. What are the symptoms? Very high temperature, confusion, headache, vomiting, and in few cases seizures or fits. If you find any worker or any person is working in the heat or sun, if he develops any one of these, most important is very high temperature of the body, dry skin, you may suspect it as heat stroke. Now, what you will do? If you are there, what you need to do? Immediately you need to call for the assistance, medical assistance. By the time medical assistance arrives, what you need to do as first aid measures? Shift the patient to the cool place or shaded areas. Wash the body. Just listen, this is very important point. Wash the body. If you get cold water, fine. Otherwise, with the normal water, soaked cloth with water, you cover the person till his temperature comes down. But in enthusiasm, don't bring the temperature rapidly below 101 degree Fahrenheit. If you bring that, there may be other problem might arise. That's why slowly you try to bring the temperature up to 102 degree Fahrenheit. If patient develops vomiting, you see whether he is lack of body or there is dehydration, lack of water, or there is dehydration or not. That you must see by seeing their hot and pale, dry skin. That you can see with this heat stroke. Because heat stroke may endanger the life of the person suffering from heat stroke. So after doing first aid, try to shift to the nearby hospital or clinic to the patient. Another comes the heat exhaustion. Heat exhaustion is the one step before heat stroke. What happens in heat stroke, heat exhaustion? You will find the high temperature in this also, but here there will not be hot and dry skin. Here it will be cool and pale skin. This makes the difference. In heat exhaustion, most of the cases patient will be conscious. Although he might complain, you get body pains, headache, vomiting, but he will not be unconscious. In heat stroke, most of the cases, patient will be irritable, even not unconscious, he will be irritable, he will be confused. This is the main difference between heat stroke and heat exhaustion. Treatment, first aid is the same in heat exhaustion and heat stroke. In heat exhaustion, we have to replace the deficient water in the body by giving sips of water if patient is conscious. If patient is unconscious, irritable, by IV saline you can, and that can be done in the nearby hospital or clinic. This is the main difference. Now, how to prevent? As far as possible, avoid working in open sunlight. Means those who are working in the farming, those who are working in the fields, in the open sunlight, try to avoid the hot sun, like from 12 to 3. In between, maximum their heat is there. You try to avoid those periods of working. Even if it is necessary to work, get yourself fully hydrated, means take plenty of water between your work schedule so that you will be fully rehydrated. If during working hours you feel a mild thirst, don't ignore it. If you feel thirst, immediately you take water, fluid, juice, whatever. You must take all those things. Second thing, never use alcoholic beverage while working in the sun, because most of the alcoholic beverages causes our body water to lose through urine. If you do that, so already your body is losing water through urine, over and above working in the hot, humid climate, so it will increase your chances of getting heat stroke or heat exhaustion rapidly. Heat stroke and heat exhaustion affects extremes of the age, means young children, old age very commonly, alcoholics very commonly, diabetics also very commonly because of their hydration status. They are usually dehydrated. What you need to do? Before going to work, carry your own water so that you can rehydrate yourself. Minimum in India, tropical countries, minimum during summer, you need to drink 2.5 to 3 liter water per day. Water, fluid, juice, whatever be, minimum it should be taken in India because it is tropical countries. Second thing, in between the work, when you are working in the hot climate, take rest definitely for 15 minutes in shaded areas. Third things, if patient becomes unconscious while doing work in the hot humid environment, you have to be very careful. You need to immediately shift the patient to the hospital. This is second thing. If patient develop fits, few people become irritable and develop fits. Fits is a serious condition. It may take life of the person. If develop fits, as early as possible, shift to the nearby hospital. Now, what do we understand with this? Do work if necessary in the hot climate, but keep yourself rehydrated, whether it is water, fluid or juice. But don't rehydrate yourself with alcoholic beverage. It will cause more damage to your body. That's all. Thank you.